Florida is one of the nation's coronavirus hotspots now. Health officials today reporting more than 12,000 new infections in that state, the fifth straight day that new cases there have topped the 10,000 mark. Joining me now, Florida Congressman Matt Gaetz. Congressman Gaetz, Florida is one of the hotspots. What is the governor there? What is the federal government going to do about it?
In Florida, we've captured a great deal of the coronavirus through world-class testing. We're testing nearly 100,000 people a day. We've learned in Florida that young people who do not fear the virus are very unlikely to alter their behavior as a consequence. And so we're seeing a great deal of asymptomatic spread. And as we find more cases, the average age continues to drop. That's because we've gone on offense in assisted living facilities and in nursing homes, but where you've got young people getting together for whether it's the Black Lives Matter protests or in house parties or with one another in a variety of circumstances, you see that spread not causing an increase in the death rate. And I think we can also suggest that these medical innovations that we've experienced, that the federal government has really led, have helped reduce that death rate, whether it's the hydroxychloroquine that the Wall Street Journal did a great report on recently. If it's taken early, it can be helpful in enhancing survivability, or Remdesivir, which Dr. Fauci called a total game changer, or whether it's the new opportunities with Moderna Inc. in concert with the Trump administration and the National Institute of Health developing a vaccine that will be deployed to 30,000 Americans. Let's hope that that continues to keep the death rate low and help us get the economy moving again and reopened.
Let me put on the screen the numbers from Florida. Total cases at last count, 350,000 and a fraction. The number of deaths, 4,982. It is true, if there is a silver lining here, that the death rate is much lower in Florida than it was in, for instance, New York when the virus was raging here.
I think that in New York, you saw a lot of spread in nursing homes where if someone's getting coronavirus, there is a very high mortality rate. In Florida, you have to drill down into the numbers to see precisely who's getting infected. And again, it's a lot of young people who aren't going to end up seriously ill in a majority of cases. And it's one of the reasons why we're opening school in the state of Florida. Here in the county where I live, we'll be opening school on time. And I'm proud of our superintendent of schools, Marcus Chambers, for implementing sanitation requirements, for having social distancing opportunities to manage the flow of students in and out of locker rooms so that we can limit that spread. But the risk of closures, whether it's to our businesses or to our schools or our jobs, really impacts people in a very negative way, whether it's economically or their mental and physical health.
Yeah, one bit of good news today came from Jack Nicklaus. He announced that he and his wife at the age of 80 had contracted coronavirus, and both of them are over it. It was several months ago, he said. So it can be done. You are an advocate of opening schools, so you're welcoming that announcement from your local school superintendent.
Unquestionably, I think that when students go to school, we see rising instances of bad behavior from those students. We see lower nutrition rates. We also see instances rising in physical violence and sexual violence. And so it's very important to us in the state of Florida to get schools open. Now, we have to do so safely. That means more sanitation stations. That means different bus routes. That means that if there are students who want to accept a digital path or a distance learning path, that we provide that to them, and then we use that as an opportunity to create more spacing in the classroom. The guiding principle in Florida and throughout the country should be parental empowerment and parental choice. If you've got students with autoimmune deficiencies, or if you've got households that are multi-generational, maybe you make a different choice than circumstances where you have a higher risk tolerance. But ultimately, I think that the risk of not having an in-person option for parents far outweighs the risk of the virus, particularly with young people.
The Republican National Convention is coming to Florida, Jacksonville to be specific. It was scheduled originally for North Carolina, but moved to Florida over, some of North Carolina's concerns about the spread of the virus. Is it a mistake, do you think, to bring the convention to Florida under these conditions, or are you going to welcome those delegates with open arms?
Well, we're excited about the convention. It may look a little different. We may see more of it outside. We may see truncated events, and we may see, more hand washing stations, more hand sanitizers, and I hope masks for people who are going to be close to one another. But look, we're excited about nominating our president because we're excited about the prospects in the upcoming election. The big question is whether or not Americans want more stuff open or more stuff closed, because it's not going to stay the same. If Joe Biden's elected president, I think the only thing that'll be open will be the jails and the borders, whereas President Trump wants our businesses open, he wants our schools open, and he wants to rebuild an American economy that was the greatest in the world before this virus struck us in such a significant way.
Republican Congressman Matt Gaetz of Florida, thank you.
Thank you, John.
And Congressman Gaetz also will be featured in a new documentary called The Swamp, an inside look at Washington politics. It debuts August 4th on HBO.